Hello everyone and welcome to our channel. Today we're going to talk about a serious topic, acute lymphocytic leukemia, or ALL. This is a type of cancer that affects the blood and bone marrow. We'll cover what it is, its symptoms, how it's diagnosed and treated, and what you can do to manage it. Remember, this information is for educational purposes and shouldn't replace professional medical advice. So, what exactly is acute lymphocytic leukemia? Let's break it down. Acute means the disease progresses rapidly and creates immature blood cells rather than mature ones. Lymphocytic refers to the cells it affects, which are the lymphocytes, a type of white blood cell. Leukemia itself is a cancer of the blood-forming tissues, including the bone marrow. In all, the bone marrow produces an excess of immature lymphocytes called lymphoblasts. These abnormal cells can't function properly and they multiply quickly, crowding out healthy cells like red blood cells, other white blood cells, and platelets. This crowding is what leads to the symptoms of the disease. ALL is the most common type of childhood cancer, but it can also occur in adults, though it's less common. Now, let's discuss the signs and symptoms. Because ALL affects the production of healthy blood cells, many of the symptoms are related to having too few of them. For instance, a shortage of red blood cells, which carry oxygen, can lead to anemia. This might make you feel tired, weak, pale, and short of breath. A lack of healthy white blood cells, which are crucial for fighting infections, can result in frequent or severe infections and fevers. And when you don't have enough platelets, which help the blood to clot, you might experience easy bruising or bleeding. This can show up as frequent nosebleeds, bleeding from the gums, or tiny red spots on the skin called petechiae. Other general symptoms can include pain in the bones or joints, swollen lymph nodes in the neck, underarm, abdomen, or groin, and a feeling of fullness below the ribs, which can be caused by a swollen spleen or liver. Some people might also experience loss of appetite and unintended weight loss. Knowing when to see a doctor is crucial. If you or your child develop any persistent signs or symptoms that worry you, it's important to make an appointment with your doctor. Many of the symptoms of leukemia can be caused by other, less serious conditions. But it's always best to get a proper diagnosis. An early diagnosis can significantly improve the outlook. Don't ignore persistent fatigue, unexplained fevers, or unusual bruising. Your doctor can perform initial tests and, if necessary, refer you to a specialist, a hematologist, for further evaluation. If you're ever feeling overwhelmed or anxious about your health, talking to a healthcare professional is the first and most important step. So, what causes ALL? The exact cause isn't fully understood, but we know it happens when a bone marrow cell develops errors in its DNA. These errors tell the cell to continue growing and dividing when a normal cell would stop. This leads to the overproduction of abnormal, immature white blood cells. Scientists believe that in most cases, ALL isn't inherited. Instead, the genetic mutations that lead to the disease are thought to develop after birth, likely as a result of a combination of genetic predispositions and environmental factors. It's not something you can catch from someone else. There are certain risk factors that may increase the likelihood of developing ALL. For example, previous cancer treatment with certain types of chemotherapy or radiation therapy can be a risk factor. Exposure to very high levels of radiation, such as from a nuclear reactor accident, has also been linked to an increased risk. Additionally, certain genetic disorders like Down syndrome can increase the risk of developing ALL. Having an identical twin who had ALL, especially at a young age, also slightly increases the risk. However, it's important to remember that most people with these risk factors never develop ALL, and most people who do develop ALL have no known risk factors. Now let's talk about complications. The complications of ALL can arise from the disease itself or from its treatment. The uncontrolled growth of leukemia cells can crowd out healthy blood cells, leading to anemia, infections, and bleeding problems, as we discussed earlier. The leukemia cells can also spread to other parts of the body. One of the most common sites is the central nervous system, which includes the brain and spinal cord. This can cause symptoms like headaches, seizures, vomiting, or balance problems. Treatment for all, especially chemotherapy, can also have significant side effects. These can be short-term, like nausea, hair loss, and mouth sores, or long-term, such as an increased risk of other cancers, heart problems, or fertility issues. Your medical team will work closely with you to manage these side effects and complications. So how is all diagnosed? The process usually starts with a physical exam and a discussion of your symptoms. If your doctor suspects leukemia, they will order blood tests. A complete blood count, or CBC, can show if the levels of red blood cells, white blood cells, and platelets are abnormal. If the CBC results are concerning, the next step is typically a bone marrow test. This involves two procedures, often done at the same time: a bone marrow aspiration and a bone marrow biopsy. A small sample of bone marrow fluid and tissue is taken, usually from the hip bone. These samples are then sent to a lab where a pathologist examines them under a microscope to look for leukemia cells. Further tests on these cells, such as cytogenetics and molecular testing, can help identify specific genetic abnormalities. This information is vital for determining the specific subtype of all and planning the most effective treatment. Imaging tests like X-rays, CT scans, or ultrasounds might also be used to see if the cancer has spread to other parts of the body. When it comes to treatment, the primary goal is to achieve remission, which means there are no signs of leukemia cells in the body. Treatment for all is typically done in phases. The first phase is called induction therapy. This is an intense phase of chemotherapy aimed at killing as many leukemia cells as possible to induce remission. It usually requires a hospital stay. The second phase is consolidation or intensification therapy. This phase is designed to kill any remaining leukemia cells that might not be visible but could still cause a relapse. This also involves chemotherapy, which might be given in cycles over several months. After that comes maintenance therapy. This is a less intense, longer-term treatment, often lasting for 2 to 3 years, to prevent the leukemia from returning. It usually involves lower doses of chemotherapy that can be taken at home. For some high-risk cases, or if the leukemia returns, a stem cell transplant, also known as a bone marrow transplant, may be recommended. This procedure replaces the diseased bone marrow with healthy stem cells from a donor. Targeted therapy drugs and immunotherapy are also becoming more common, offering new ways to fight the cancer cells with fewer side effects. What about alternative medicine? While some complementary therapies might help you cope with the side effects of cancer and its treatment, no alternative medicine has been proven to cure all. It's crucial to understand that relying solely on alternative treatments and delaying conventional medical care can be very dangerous. However, therapies like acupuncture, massage, meditation, and yoga can be used alongside standard treatments to help manage symptoms like fatigue, nausea, and stress. Always talk to your doctor before starting any complementary therapy to make sure it's safe for you and won't interfere with your cancer treatment. Open communication with your healthcare team is key to integrating these therapies safely and effectively. Finally, let's touch on lifestyle and home remedies that can support you during treatment. Living with all and undergoing treatment can be incredibly challenging, both physically and emotionally. Taking care of yourself is paramount. Make sure you get enough rest. Cancer-related fatigue is very real and can be overwhelming. Listen to your body and rest when you need to. Eating a healthy diet is also important. Good nutrition can help you feel better, maintain your strength, and cope with the side effects of treatment. A dietitian can help you create a meal plan that works for you, especially if you're dealing with nausea or mouth sores. Gentle exercise like walking or stretching can also help combat fatigue and improve your mood, but always check with your doctor before starting any new exercise routine. It's also incredibly important to take care of your mental health. A cancer diagnosis can bring a flood of emotions. Connecting with a support group, talking to a counselor, or leaning on friends and family can make a huge difference. Don't be afraid to ask for help. There are many resources available, and you don't have to go through this alone. That brings us to the end of our overview of acute lymphocytic leukemia. We've covered a lot of ground, from the basics of the disease to the details of treatment and self-care. It's a complex and serious condition, but advances in medicine have dramatically improved survival rates, especially for children. Research is ongoing, bringing new hope and better treatments all the time. If you or someone you love is facing this journey, remember to work closely with your medical team, build a strong support system, and take things one day at a time. Thank you so much for watching. If you found this information helpful, please give us a thumbs up and subscribe to our channel for more health-related content. Stay safe and take care.